last hiccup, we had some little hiccups here, technical difficulties, but it's totally fine. We're still here for you. We're still gonna talk about this COVID-19 and being proactive at it. So, it doesn't matter. It's not gonna stop us from what our main focus is. We wanna inform the people. It doesn't matter. Aloha, my name is Ikaika, Puna resident. This is my friend Dane DuPont.
How's it?
He's also a part of Hawaii Tracker, and he's been tracking this pandemic for
2 months.
2 months, should I say? And he has a lot of stats, numbers, and that's what I am. I love numbers. I love stats. I like to share information and truthful information that is happening on the road. I have also my friend Philip Ong, my partner in crime. He'll be here supporting on what we'll be talking about and relating relating what's happening during the eruption and what's happening now, and we can make those relations just so everybody know what we're talking about. So let's dive into it. So everybody knows what we have done in the eruption. Well, majority of everybody out there in our audience have known what we have done in the past 2018 Lower Puna eruption. So let's kind of relate what's happening. So May 3rd was the initial eruption in Leilani. Before the eruption happened, there were signs of an eruption coming. So those signs were earthquakes. Earthquakes, 5 to 10, then picking up to 50 to 80, then picking up to 100 to 300, then picking up to 3 to 500, and then boom, eruption. So that's what we're looking at right now. We're looking at the earthquakes. It's happening. What are we gonna do? What's the plan?
Right.
What is our proactive plan that we should initiate right now? What's your thoughts?
Yeah, there's a lot we can do, but I think starting with eruption is really a good way to relate it. We see all these signs of impending, approaching stress on our community, right?
Mm-hmm.
It was actual physical earthquakes. Now it's COVID-19 cases,
Right.
deaths as well, and we can see that these events are getting closer and closer to our shore.
Yeah. So what we're relating is like Iran, Italy, China. That's Halimau. That's the Halimau as we can speak. And now the trickle is coming down into the areas like us, and it's upon our shores. It's I'm not gonna scare anybody, but I just want everybody to know and be ready for something like this once it hits our shores. Being proactive, being aware, letting your family know what's going to happen. Going over the precautions and the proper precautions to keeping your family safe. So we want to go over the COVID-19 information update. So I'm going to read it out to you guys. The best way to protect yourself is to wash your hands frequently and thoroughly using soap and water for at least 20 seconds. So at least some of us, Hawaiians, we just like use bathroom and just walk right out. Sorry, we gotta stop that. We gotta sit, go in there, wash your hands. If you can go all up to your elbows, go right up to your elbows, because any exposed skin can be a carrier. So use alcohol-based hand sanitizer if soap and water aren't available. So if you can go to the convenience store and get you some sanitizers, please do so. Have them in your car, in your homes, every part of your home, if that's okay. In your purse, in your pocket. There's small ones, you can have that. And if you just go ahead and out of the blue, just sanitize your hand. Cough or sneeze into a tissue or flexed elbow. So pretty much, coughing into your elbow. Then throw the tissue away. Would be a great thing to do. Avoid touching your eyes, nose, or mouth with unwashed hands. So do not touch if all possible, please don't touch your hands touching your face or your mouth and anything else. Don't even touch somebody else's mouth. And all these precautions it's just being proactive. So another thing too is the virus usually spreads from close person to person contact. So, within 6 feet, right. That's the buffer, 6 feet. And us Hawaiians, us local people, not only Hawaiians, everybody on island, we like to aloha the people around us, our aunties, uncles, kupuna, grandparents, friends, family. That's the way. That's the sign of aloha. But now is the sign of aloha is probably just on shaka, and we can do that, and that's a good thing to practice right now. The virus may also spread through airborne transmission when tiny droplets remain in the air even after the ill person leaves the area. So, you could have another thing too that was brought up to me by some of our kupuna in our community. Masks. Have one mask in your car. So if you're going to go to the grocery store, put that on. When you can get back into your car, take it off.
Right, and it all goes along with just a multi-layered approach to this whole thing. So the mask in and of itself isn't going to save you.
Right.
But it, in addition to everything else, taking proper precautions, social distancing, the things that we're going to go into, these proactive measures that we'd like to, showcase for you, and like their effectiveness and why they will work a little bit. That's what, where that type of thing really helps.
Right.
There is no one-stop shop solution to this. Just washing your hands, not going to be enough.
Right. There's more to it. Symptoms may develop within 14 days of exposure to the illness. And this is what was brought up to me. Some of you out there might not even know you have it. Might be just a early wake up in the morning and it's just a little slight cough. Boom, boom. I mean, really, really minor cold. And that could be a sign of the virus. We really don't know.
Right. 80% of those that will come in contact with this virus will develop some kind of mild symptoms. Now, mild could be anywhere from you get a flu type of situation. It's intense. It puts you out for a week, but you don't need. It doesn't require hospitalization in that one,
right?
Or a high fever or something along those. But a lot of other ones will be a mild fever, only a few degrees higher. So it'll be something like a cold or a dry cough, a slight temperature increase. The scale in that 80% is pretty wide.
And sometimes you can be like, you have you feel kind of weird for a couple hours and it goes away.
Mm-hmm. It can be weird, but that's the thing is that's how it gets transmitted so much. As if it was super infectious and put you down real quick. Well, then it just doesn't spread.
Right.
It's spreading through the people that feel good, basically.
Right. Avoid close contact with people who are sick, sneezing, and coughing. A lot of these things are very common sense. Exercise common sense during this thing. Yes, it's not. We don't know if it's on our shores, and our CDC and our county government and state government are trying to do the best that they can. But as of right now, we really don't know. But in precaution, please take all the proper needs to take care of yourself, take care of your family, and also your kupuna. Your kupuna is the ones that will be exposed. So let's go to this video. It's called COVID-19 March update. I'm gonna play this video, and then later on we can talk more about it.
Right.
Here we go.
Rate in China was actually
10th. But then it fell steadily over time, until it was only 0.8% for patients with symptom onset after February 1st. There are two main reasons for this. First, the hospitals and clinics were initially overwhelmed and couldn't manage the disease, so both patients and healthcare providers were getting severely ill and dying. But within a few weeks, with better equipment, testing, and processes in place, the healthcare system responded and brought down the fatality rate dramatically. Now, as a point of comparison, the flu typically causes a fatality rate of 0.1%. So, even based on this data, COVID-19 is still 8 to 35 times more deadly than the flu. It's also worth pointing out that for COVID-19, the mortality rates differ by group. So, for example, if you split things out by age, you can see from this table that fatality rate is relatively low if you're below 60, with no deaths seen in children 9 and younger. But then it starts to really climb up for the elderly, so they're really the ones at highest risk. Similarly, the fatality rate is higher for folks with hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer, relative to folks without any of these conditions. And of course, a lot of the elderly typically have one or more of these conditions, so it's not surprising that they go hand in hand. Now, although the COVID-19 pandemic is still ongoing, the good news is that in China, and also in South Korea, the number of new cases per day has dropped off, largely due to the aggressive public health measures like quarantining, aggressive testing, and ensuring hospitals have the right equipment and staffing. Based on
based on what we just watched, the impacts would be our kupuna. And I was thinking of ways to, our kupuna is our matriarchs of who we are today. They have the knowledge. They pass down the knowledge to us, and now we pass it down to our OPO or our keiki, our kids. But I was thinking of ways to be proactive within our community with our kupuna. And one of the things that brought up was, some of our supermarkets, some of our stores, if we can imply and initiate something with the supermarket kitty and Walmart, Target, and all these main supermarkets that our kupuna go to, if we can say like, hey, 6 to 9:30 p.m. all that's kupuna, we can have our kupuna go and shop in during that time.
Right.
So just kupunas in itself, then we're doing something proactive with it, because if we start to open it up and young people that don't even know that they have it, right, and our kupuna is shopping near these people that are infected by this virus,
right,
we could see a devastation, a huge impact with our kupuna and on island.
Right, and the idea would be to put out these requests, or to have these businesses come in. Basically, when do they clean? When is that store the cleanest?
Right.
Well, immediately following that should be the time that you let in the elderly, basically,
right,
to protect them against the exposure.
Right.
They're going to need supplies too. They're going to need toilet paper and all those amenities that
right,
we take for granted almost right now.
Right. And now, and also in that video was about our infrastructure. Our infrastructure that we have here on island, is it feasible to accommodate a pandemic that so vicious like this on island? Is it helpful to know what we're up against?
Right. You got to know your enemy.
Right.
You would know this better than anybody, what the eruption was,
mm-hmm,
and then like the differences in this.
Right.
Like
well, eruption was, we were losing homes, losing property, losing memories. This is way more worse. It's losing lives.
And also the lava was loud, it was bright, you could see it from everywhere, smell it from everywhere, you could feel it.
Right.
This is invisible.
Invisible.
If you see it, it's too late.
Right. So now we have a graph of the world here, of the impacts in different area. And if you see this here, so this is the United States.
All over.
Right. Hawaii, we have a small dot, and you can relate to this as a, from the eruption. This is like earthquakes.
Basically.
Right.
And you want to see a big earthquake? Boom.
China.
Yeah, so China would be like our pool when that event initiated. We were hoping there wouldn't be as long-lasting and as far-reaching an effect, but it's kind of cascaded into one place to another, working its way, and it seems like it's inevitable now.
And 182,000 plus people confirmed.
So far.
Not dead, right?
No,
But confirmed cases. So
7,154 deaths so far. Italy's really the scary one in this whole thing that we have data on. So one of the things that I can talk about is during the eruption, civil defense had no idea how many houses were lost, especially in May.
Right.
They were completely off by hundreds, right? But that had to do with just the inability to account during the situation.
right.
What I would call the fog of war. So you couldn't see past type of thing. And there's countries that's true too. Now, Italy's interesting because we can actually see it at a high level of this infection and what it does to a world-leading infrastructure in medical and how it can just be completely overwhelmed. And right now, the Italians, we have to zoom in.
Confirmed.
2,749 deaths. The scary thing about that one is in Italy currently, the mortality rate's around 6.5%. That's very high. In other places, as you saw in the Chinese video that we just watched, they were able to bring it down to 0.8% when they got a handle on the whole pandemic.
Right.
That doesn't say that there's a handle on it right now.
Right.
That's scary. That's
Right. So there's a natural rate, and then there are things that people can do to keep it a natural rate, or mistakes that we could make which would increase the rate, and that's what we're really trying to
right. That's what we're going to
And this is what I want to, Dane had showed me a graph of if you go down more, Dane, I would love to show these guys a little bit more of the some more like this. This is just a mock-up, so let's explain this one.
Yeah,
man.
let me walk through.
Yes,
All right.
please.
So this is a simulation based off 200 patients, right? Just left to their own devices, they just wander around, normally.
So without any
No measures.
Proactive
Literally nothing.
initiative or wow.
Yeah. So-
Literally nothing. This is what happens. This is what you're facing with literally. And we've gone 2 seconds and we've already gotten 34 infections.
So one person that is infected, watch.
Watch one person.
Oh,
Oh, it skipped. Let's try again.
right here. One. Boom, boom, boom. So within no time, it could be spread.
And when we say
And you see the curve line on the top.
right,
That's the thing that we want to. The spread would be so fast.
right,
One person. So this is. Can we stop now?
Yeah.
So, in South Korea, 80% was it? 80% was spread by one person.
yeah, that's what it seems to seem is. So you had 30 patients, and they seemed to have a handle on it for a while, and there was the cruise ships and all kinds of stuff. But anyways, they had a handle on it, and then patient 31 came around. Don't be patient 31. Patient 31 had COVID and was supposed to be under isolation and quarantine, and decided to go out
Right.
and decided to go do his thing. And now he is responsible for 80% of the outbreak in Korea can be traced back to the two
Just one,
clusters
yeah.
that he caused.
Damn. So we, as far as an island like us, this could be majorly impact
Right.
severely in no time.
And
so,
this one right here is like kind of what we have. We have with the islands a forced quarantine, other than the airports and the ships coming in. But it is kind of a forced quarantine if we shut it down. But this shows you how a forced quarantine doesn't really work either. It's better than free-for-all.
to
but
play
not
that
by
from the
much.
beginning. I'll rewind that.
Yeah. All right.
Okay,
so
here
we're
we
in
go.
and
So the
out.
next one, and here's the simulation right there. Forced quarantine. But once somebody get out, boom.
As everybody's still moving around inside, it's just a matter of time until it gets in. And once it gets in, it doesn't matter again.
It's a slight delay, but
Slight
it still
delay.
comes.
Still comes, yes.
So now, moderate social distancing.
So like people staying home and just one member goes out.
Right. And this isn't because you're sick. This is just you stay home.
Right. But the line is pretty much flat all the way. And now here's extensive social distancing. So now we see the line. People are getting affected, but people are recovering almost as fast as people are getting affected, right?
Right. Yeah. And this is what we need to have.
So free for all, you see that curve line, and I love these numbers because these numbers is up to date and pretty much right spot on. So free for all, you see the curve line just goes straight up, and that's what we see in Italy. If we go up a little bit more, there, bang, Iran, you see that curve line just goes straight up, 9,000. There is we don't see any flattening out where people are recovering more than people are getting affected. We don't see that. Italy, same thing. South Korea, we see the curve line go straight up, and then now it's starting to balance. So now people are recovering more than people are getting affected. So that's the curve line. And Japan got a hold of it. But if you look at United States, that curve line is starting to come up straight up. So but Singapore got it, and it's so unique about Singapore. Singapore it's one of the most cleanest countries in the world, and Singapore got a hold of it from the beginning. They was proactive from it. If somebody was affected, they would pull that guy aside, and ask him questions. Who did you go with? Where did you go? Who did you touch? Were you with anybody?
You lie, you're getting fined.
And if you lied about it, and there were people there were pretty much on you. If you lied about it, you would go to jail and pay a big fine.
Yeah.
So they got a handle on it. Singapore is like on it. So, but if you can see United States, that line is pretty much hooking straight up. So.
Yeah. The what was it? The Surgeon General came out today and said basically we're 2 weeks behind Italy. So we're shadowing Italy by 2 weeks. 2 weeks ago in Italy, it was fine, or fine-ish. It wasn't what it is today, where you can't see.
But just looking at this graph, if you look at United States and Italy, it looks pretty much the same. The curve looks pretty much the same. So far, yes.
This is just showing some of the same data, just a little differently.
Right.
And you can see it again. You can see Korea with this yellow line right here.
They got a hold of it.
Flattened it out. China took them a while, but got a hold of it, flattened it out. But all of these lines, yet undetermined, but looking like sloping upwards.
Right.
And this is deaths. And here's what I was just talking about. The fatality rate in Italy doesn't make any sense. It is way too high. And you can see it on this graph how it just is skyrocketing. So one of the main issues with this is you might think, mortality rate of whatever, 3%, 2%, 1%. The real issue is about how much patients is going to be served into the hospitals where we already have limited infrastructure on this island. Right. So we're talking about 5% of the people that would get it would require hospitalization for an extended period of time. That's weeks type of thing on a ventilator, on a respirator, trying to get in breathing assistance and helping it so you just can breathe and get enough oxygen into your blood. So
if we pull out the numbers, population in Hilo is just rounded off 50,000.
Yeah.
Right? In Hilo, us alone, our hospital is capacity maybe 300 tops.
I think that's more than. Yeah, that's way. I think that's more than the island almost in terms of some of the beds. But yeah, that's about right. That's about right. Yeah.
Ballpark. We're gonna go ballpark.
Yeah.
What percentage is that on the 50,000?
Well, if you're looking at say 10% of 50,000, so first one thing is that anywhere from 30 to 70% of the population.
That's less than 1%,
Well,
right? 500 is 1%.
right.
So if
Yeah,
we
we
have
just
300,
blow it up real quick, basically.
Yeah,
That's what I'm
so-
getting to. We blow it up real fast.
so the beds in Hilo Medical Center is
Right.
less than 1% of our population in
definitely.
Hilo.
Yeah. It's
Right.
and usually that's up in like 1.5, 2%.
And if we ask
twice
about
that,
5% of 50,000 population,
yeah,
which
then-
is affected hard, that need hospitalization, that needs,
right. All kinds of care.
oxygen tanks and whatnot. 5% is what out of 50,000?
So we're talking
2,500.
Yeah, 2,500. Yeah, right there. And
So that's where the rate of and we're not trying to scare anyone. We're just trying
Yeah,
to
this is
make
just
these
real.
numbers.
This is-
This is real numbers. 5% is 2,500. So we are
and this is just ballpark.
2,000 beds from being up to par. Not up to par, but to
up
be to change that
right.
curve.
So we need to bring the curve down. We have to bring that curve down. Because
And the reason why the curve is going up is because our infrastructure. Once we fill up that beds in our hospitals, and we have 2,000 people that needs it because
Then
it's the
we're in
5%.
trouble.
Then
Yeah.
we're in trouble because that's when that curve goes up.
Right. And they're not gonna get it all at once, and that's gonna be over time. But yeah,
Yeah, and that's Italy right there.
that's Italy right there.
Right.
That's when you turn into Italy.
So if we look at Italy, we thought Italy would have one of the top of the line medical fields, but I'm guessing
it can overwhelm even the best.
Right.
That's what we're seeing. Switzerland is also getting hammered by it, and they're home of the Red Cross.
And,
basically. They're getting-
before we go to any further, I just want to mahalo all our medical physicians that is in the field right now. They're the people that are the heroes right now. They're the people that will be facing this head on. We're there for you guys, and I like to mahalo everybody that is in the medical field in Hawaii. Mahalo.
Right.
Yeah, in Italy, there are some similarities to Hawaii. In Italy, people are very friendly. They hug all the time.
Right.
They kiss all the time, right? There's some echoes to what Hawaiian culture offers, right?
The older demographic as well in Italy.
Right.
Right, the age. There's a lot of old people in Italy, right? As a
Right.
proportion of population, right? So what went wrong in Italy is what we should learn from
Right,
here,
right,
right?
exactly.
And they didn't do the social distancing as much. And clearly that's had an effect.
And that's Hawaii. Hawaii is very social, very family oriented. Our ohana is everything to us. Everything that we do, weekends, we're always with family. We're never by ourselves. We're always with family, friends. Sometimes we're with friends and family more than we usually are, but that's just our culture here. And I'm sorry, we might have to change. We don't have to change forever, but we're gonna have to change for now, just the way we look at being proactive while this COVID-19 is coming upon our shores.
Yeah, well, just be real with you. The life will change for the foreseeable future.
Right,
Now.
right.
There's nothing to suggest that this is going to blow over.
Right.
There is nothing in the data to suggest that this is, going to miss us or something along those lines. It's just mathematical certainties at this point that it's coming.
Right. I know there's questions out there. I really want to answer. The ships coming. There was rumors of a ship coming to Hilo this Friday with passengers getting off and catching airlines back to wherever they came from, San Francisco or a couple hours ago that was canceled, right?
That's right.
If I'm not mistaken, yes.
It was canceled in Hilo, rerouted, I think, to Honolulu last I heard. I don't know. Tentatively there, but the one interesting thing about that one is they were at sea for over 14 days, which is the incubation period for the disease.
Mm-hmm.
And if nobody's tested positive, nobody's really sick on that type of thing.
That's good.
So
that's good to know.
But here's the thing: is how many airlines come in? We
Right,
know that.
right. So we have problems here and there that could be addressed by our government
Right.
right now. our county government can do whatever they can do. Our state government gonna do whatever they can do, but it's the powers above that. I think we can take into initiative that if you're gonna travel, please travel irresponsibly. Carry the things that can be, because we don't want to go. We don't want people. And if you're thinking of traveling now, and you're thinking of coming back, just I mean, common sense. If you feel something, go test yourself.
Well, just self-isolate.
Self-isolate. Yes, that's true. Self-isolate. You don't want to be a statistic.
Right. Go past that 14-day incubation period. Isolate. If you're good to go, you're good to go. Basically
Right.
At that point.
And that's how we can stop it from coming to, or get a grip on it if it does come on shore. And some people, I'm gonna have to agree with some of you out there. You guys gonna be kind of hot-headed, wanna go and your friend calling you, hey, come over my house, we get one barbecue, but you feel a little bit sick. Please, strong mind, stay home, have your wife, husband, son, daughter bring food to you, but we gotta play it safe for now until we can get a grip on it.
Right, and it's no small feat what we're asking here.
Right.
Like, this isn't going to be an easy one. This isn't just curb a little bit of behavior and we ride this out. There needs to be sweeping changes. And we'll regret it later if we do not do them.
Right.
And it's hard. I mean, it's hard to change your life based on something you can't see or touch. Right. The lava did change people's lives, but your house burnt down.
Right.
You saw that, or you saw it on the news, or whatever, a day later. But it was real like that. I don't think a lot of people feel it as real, just because it's intangible.
Right. So right here, what are we looking at? Flattening the curve.
Right. So we're just going to go through this type of thing. So this is generally what we're talking about is the level of the health care system to be able to process these patients in addition to the normal patients they have to go through. People are still going to have strokes. People are still going to have ear infections and all the like.
People going to have flu.
Yeah. Anything and everything they still have to be able to treat. We have limited resources on the island. We already know this, and so we really got to keep this thing down. We can't let it get ahead. And this is no small feat. How big are we talking? Well, we're talking about U.S. cases right here. This is a U.S. graph based upon the amount of patients that are going to be, the 5 to 6% that are going to be in serious condition, the life-threatening type conditions, right? This is a bell curve of those. So what we're showing here is this is the unchecked free-for-all that one simulation we showed. That's what will happen basically. So what does this red line right here represent? Well, that's the actual level of the U.S. medical system to deal with this pandemic, and that's what their capacity is. So that's not a small feat we have to do, right? And when we do that, it prolongs the whole thing out, right? So we don't get a quick spike, we get a long, drawn out situation. But here's the thing about drawing it out is that's a benefit because we have the best and brightest minds on the planet collectively. This is doesn't happen really. Collectively working on the same problem, working in parallel to achieve the same thing. Treatments and vaccinations are coming. It's just a matter of safety.
Yeah, it's a matter of doing the proper precautions and things that you gotta, common sense stuff, and try to do this as much as possible. Being proactive, being very stern on what you need to do on your daily. If you gotta go buy something, take 1% out, buy it, come back, take the precautions, take your the sanitizers out with you, wash your hands, and we can flatten out the curve.
Right.
Until we have the vaccines out, we gotta slow down the process of this virus coming to our island.
We gotta buy time. That's all we can do.
That's how we can do. Buy time until these physicians can get the medication and the proper vaccines out for us.
Yeah, there is hope.
There is hope. Yeah, and trust me, guys. Our medical physicians are doing the best that they can, and they're going to try to do it as fast as they can. So it's only to me, it's just a speed bump. We're going to get through it with the trust of our local government. We're going to get through it.
All right, we want
Yeah,
to share it.
so this is a doctor from Maui.
Yeah.
It's easy to ignore this, and they just want the convenient answer, which is ignore it. But we can't do that. This is a really important time. My name is Dr. Emeka Okwuje. I'm a aesthetic and longevity doctor here in Maui, but my background is in anesthesia and critical care. I spent years treating people who had advanced airway disease, lung disease, heart disease, and really it's my goal here to help people in our community understand the importance of flattening the curve or doing what we can now to prevent the worsening of the impact of the COVID-19. The one thing we have to understand, I just got word yesterday that we've got some of our first test kits here on island, which is great. But what we need to realize is we're behind the curve here on reporting. So the fact that we're remote and don't have that many reported cases so far, while it is comforting, the other thing we don't recognize is that we don't really know how many people actually are infected here on the island. And what we do know is that there's lots of people disembarking from cruise ships the last 2 months, on flights from these areas. I think once we know more, we're going to be very surprised as to really how endemic the virus does wind up being in the islands. I don't think we're any different than anywhere on the mainland. I mean, we're remote geographically, but not in terms of ability to travel. We have a lot of tourists, a lot of people coming through here. And again, our response, we're just getting our response together seriously now in the last week. You brought up Italy. I think what we could learn here from the Italian experience is this, you contrast Italy in a place like Singapore. Singapore, they took social distancing very, very seriously early on. Italy, they didn't. So you have very, very different rates of spread. One looks like a hockey stick like this, the other one's flatline. Right. Okay, so which one do we want to be?
We've heard of the statistics put out there. 80% of people will be mild or asymptomatic. 15% will require hospitalization in some capacity. 5% will be serious. What's the threats of that doing to the island?
Well, so that's obviously there's a lot of there's many layers of this, and those numbers exactly right. The 80, 15, 10. So really, I was just talking to a colleague who is in the intensive care unit in Seattle. It's kind of ground zero. And, while 5% doesn't sound like a lot, the problem they're having is that they don't have the resources to take care of that 5% in a major level 1 trauma center in Seattle. So let's take a look at on the island now. Maybe Oahu might be a little better prepared, but I think the outer islands, certainly Big Island, Maui, Kauai, I don't know that we have the capacity to handle taking care of that 5% of people. And this is why flattening the curve is so critical, because if we can reduce the presentation of these individuals who have that 15 or 5% who are symptomatic and need intervention for them to survive. See, right now, we don't have the capacity to take care of that 5 or 15%. Now, if we can slow the rates of spread, I think we have a better chance. That's one thing. The other problem we have here is, let's face it, there's a lot of tourists here. And I'm not saying we have to completely stop tourism, because of course a lot of businesses.
Oh, sorry. that video had a lot of information in that little snippet. And we're gonna end this with this. We're gonna face a lot of economic impacts, social impacts within our community. Tourism is our number one source of drive for our county and our state. But to me, it's not about money. It's about the people's lives. People's lives is the main thing. I really don't really care about money. We always can get money later on. We always can, but it's our well-being of our people on island. And things need to be done in our community. People got to get to the table. People got to sit on the table. We got to get cattlemen on the table. How we can self-sustain ourselves. Cattlemen, pig farmers, agriculture, vegetables. All these people, we got to sit on the table and see how we can support our own communities. And not to mention, we're going back to the old days, being self-sufficient. Ahapua'a. How our own people in our own community would barter, trade. You get fish, you want uwala or sweet potato, I trade you for a couple manini or a couple kole for uwala. And we're going to have to go to that. I mean, this kind of initiatives, we're going to have to talk about this kind of way of living for just a little. There and that's what we should be talking about now,
right?
Because of this, I'm not too sure about everybody out there, but I think the conversation has to be open within our communities and how we can empower our communities without outside influences, without shipping in anything to us.
Right.
It's been in a talk for a long time of self-sustainable and self-sufficient. Being self-sufficient, it's been in a talk, but if it doesn't happen, if COVID-19 doesn't happen and doesn't come to our shore, and we get a grip on it in the beginning, it's still we have the plan in the master plan of being self-sufficient in place because of this, and I think we need to sit down on the table and talk about it. Right.
Everything needs to be put on the table at this point in time. Basically, we know that the CDC just yesterday announced that no more gatherings of more than 50 people.
Right.
The next day they refined it down and said, actually, let's make that 10. It works a lot better in our simulations when we start running the math on things when it's 10 instead of 50. 50 is still too high. So
right.
That's a big, tall order right there.
There's a lot of things that San Francisco is doing. Their tables are 6 feet plus apart from each other. Now they're saying, okay, now it's only takeout.
Yeah,
takeout food.
Yeah.
Sorry, we're not going to have anybody sit down and dine here if you want to eat. And then now it's becoming to be, we're going to deliver food. So other states are taking the precautions seriously, and I think here we should be. And for me, I think we live on an island,
right?
And things can be trapped on the island, and I think we gotta take it a lot serious than what we are taking it now, seriously. And
we're resilient people. I mean, I think I love your idea of sustainability. I mean, that helps us be resilient.
Right.
We've been through a crisis before pretty recently. Mm-hmm. We all suffered a lot going through the 2018 eruption, but we actually have that as a practice run
for this,
how to deal with crisis that most other people in the world don't have,
right,
to lean back on. So we know it's tough, but we know you can organize this stuff and get the resources where they need to be. And
talking to the right people too,
to make us more resilient, to draw on that inner strength once again, right, to actually, as a community, get through this.
Right. So another thing that I want to talk about is, rumors can be spread like wildfire.
Yeah.
So I've been seeing and hearing a lot of people, oh, I heard this. Oh, my friend said he went to the doctor and there was somebody in the doctor's office that was confirmed that he was confirmed COVID-19. And then that just spreads. And then all of a sudden we have rumors all over our island and it starts to create a huge panic.
Right.
We're panicking for the wrong reasons. We should panic to get us in place. We don't have any confirmed cases on island, but if you panic now, that means you're getting to a point where you want to be proactive about this situation.
Right. If you had the eruption to do over again,
Right.
and you knew on May 1st or May 2nd
What was coming?
what was coming and how long it might last, what the impacts might be, do you wish you would have taken any more steps to prepare in advance?
Right.
We're at that point now.
Right on.
Yeah.
Yeah.
Well, thank you. for
You're
doing
welcome.
this.
What you was gonna show here?
Well, I wanted to show one last thing.
Okay,
So
one last thing before we go.
A lot of people, they're like, oh, I don't know. Is it real? I don't know. Let's just show something. We're going to just switch screens here real quick. Get it over there. All right. So what we have here is Italian newspaper. And we're going to go through the obituaries.
What date is it?
This one is February 9th. So over a month ago, things were good. This is a normal day obituaries in Italy. One page, 1.5 pages. Right? So now let's look at now. Or close to. March 13th.
Marzo.
1,
3, 4, 5, 6, 7, 8, 9, 10. 10 pages. But if you look at it, it's all kupuna.
Mostly.
Yeah.
Yeah, mostly kupunas.
Right. Yeah.
And I think, we gotta take care of our kupuna. If our kupuna can't shop, let's go shop for them. Let's take the initiative and go shop for our own kupuna and take care of our kupuna. And so be proactive. Find the right sources. Find the right information, and make sure you don't spread any rumors that can create a wildfire. And stay tuned to a lot of our news updates, and also Hawaii Tracker.
Yeah. Well, we are going to be I'll just announce it here first.
Right.
We're going to be declaring disaster operation mode on Hawaii Tracker and going back into the same mindset that we were in during the eruption, because that's how it has to operate right now. It's too serious, even though it's not here yet, officially. We're well past that point. If you're not overreacting, you're not taking it seriously right now.
There's a community spread case reported today on Oahu.
Right.
And every action we take will save lives.
Right.
That's the bottom line.
So that's what we want to do, and that's why we did this tonight. We want to save lives.
Right.
Every life matters on Hawaii Island, state of Hawaii, and the reason why I chose to do this is because I love the people of Big Island. I have a passion for people on the Big Island. So, mahalo everybody, and until next time, we like to say this to you: stay classy, Puna. Aloha.